Hi, so we are going to be doing a presentation on trichomoniasis and bacterial vaginosis. So my name is Trinae, and Ava will also be presenting as well.
Hi. Okay, starting with our introduction, trichomoniasis affects the urogenital tract or the reproductive and urinary systems, and bacterial vaginosis affects mainly the female reproductive system. Both of these diseases can lead to pelvic inflammatory disease, premature delivery, cervical cancer, and other complications with pregnancy, as well as delivery. Both of these are primarily contracted through unprotected sexual contact, as as well as unsafe having multiple sex partners.
So the normal microbiota of genitalia for the female reproductive organs. So here there are several different listed that you'd find in the normal microbiota to include Gardnerella, which the overproduction of that actually can cause BV. Prevotella is something that is primarily found in the gut of pigs as well. This is considered gram negative, and this would be something that you would find in one of these diseases, as well as Synethia and Aedopobium.
Okay, trichomoniasis, also known as Trich. It is contracted through unprotected sexual contact and having multiple sexual partners. It is a protozoan parasite and it can cause serious health problems if left untreated. However, it is curable with the correct um, medicinal supplies. People can be asymptomatic, but individuals may experience pain in the abdomen as well as painful urination and painful sexual intercourse. There can be a foul odor as well as unusual discharge, which can be green or yellowish in color and is thin and frothy. Vaginal itching and cervix inflammation are also symptoms as well. And the microbes for Trichomoniasis vaginalis. It is a protozoan parasite. It's a curable STD and it is pear-shaped in vitro and amoeba-shaped when attached to vaginal cells.
So for bacterial vaginosis, this is also referred to as BV or Gardnerella. So this is mainly contracted through unprotected sexual contact as well. A lot of times people can be asymptomatic, but one of the most common signs or symptoms you notice would be unusual vaginal discharge. They also can appear gram negative and gram positive. So like I said, asymptomatic is normally what you would notice in a lot of patients. But if they do have signs and symptoms, one of the most signs that you'll see is a foul, fishy odor, or also like a discharge that can be discolored. Other symptoms that may be present, vaginal itchiness, burning while urinating, and bleeding after intercourse. So some of the microbes, some of the first few were already listed that you would see often. Some of the main anaerobic microbes you see were bacteroids and Mobilingus. Some of the other ones are listed as well, with emphasis on the Eubacterium, the rigid cell wall, and those can be seen in these photos as well.
So for virulence factors of trichomoniasis, these include adherence, cytotoxicity, which just means that vaginalis produces molecules that target cells and damages their membranes, as well as immune invasion, defenses that include degrading human immunoglobulins and resistance to complement.
So some of the virulence factors for BV, these can adhere to the vaginal epithelial cells. Also, a biofilm will be formed, and it also can produce different enzymes and can completely disrupt what you would consider the normal vaginal microbes.
So prevention and vaccines, for both, using condoms and practicing safe sex would prevent both of these diseases, as well as the lactobacillus vaccine. For bacterial vaginosis, you can also do cervical diaphragms and getting checked regularly by doctors. And treatment for trichomoniasis, you can do oral or topical antibiotics such as tinidazole and metronidazole. Metronidazole has effective tissue penetration and more milder side effects, so it is usually recommended. However, tinidazole is best used for treating parasitic infections in the vagina. So tinidazole is good for that.
So treatment for BV, normally a lot of patients will try to use their own over-the-counter meds just because sometimes the medicines will not work. However, it is recommended for them to use the oral or topical antibiotics. One of the main ones that is used for BV as well as trich is metronidazole. It definitely has milder side effects, but clindamycin can also be used to be treated.
So ages of infected, we noticed that there was a trend amongst the younger people, usually ages 20 to 24, were highly affected by both bacterial vaginosis and trichomoniasis. If you look at the graph, you can see that there is a steady decline with age in relevance to infection rates. And with trichomoniasis as well, there was a gap between the younger and older generations.
So some of the public health challenges, some of them are the same with trich and BV. So trich and BV both can cause low birth weight, preterm labor, which can also cause issues for both the mother and the fetus. Trichomoniasis is an infection that is asymptomatic and also has a high prevalence, which can make it a challenge as well as the fact that it can be very resistant to treatment by antibiotics.
So potential solutions, regular screenings, getting checked by your doctor, going regularly to the to be screened and having diaphragms checked. Education as well as knowing your body, knowing when things feel off and wrong and going to get checked when things feel different. And early detection goes into education as well. Being able to detect these early is what helps with treatment.
So some of the comorbidities with trich and BV are also the same. One of the major ones is the easy transmission of HIV and making it easier to catch, um, as well as other STIs for bacterial vaginosis. Trich and BV do have a lot of similar um, STIs that are able to be caught as well a lot easier. It makes you more susceptible to these infections. So these are some of the ones that are listed that are most common seen with these patients who have either one of these.
So risk factors for bacterial vaginosis include having new or multiple sexual partners, as well as unprotected sexual activity. This also goes for trichomoniasis, unprotected sexual activity, and multiple sexual partners. For bacterial vaginosis, smoking and hormonal changes, so birth control, pregnancy, and activities that may disrupt the pH, since bacterial vaginosis is caused by an overaccumulation of bacteria in the vaginal canal. And trichomoniasis, a compromised immune system and a history of STIs can contribute to your likelihood of contracting trichomoniasis.
So some interesting facts. Identifying trich can be very hard because of the parasite can appear gram-negative on a gram stain. So that is something that we've learned about a lot this semester on how to be able to see these certain parasites. So this was something that makes it very difficult to treat, difficult to diagnose. Also, with bacterial vaginosis, a lot of women do not have it. More than half of them do not have any type of symptoms, or they don't start developing symptoms until way later. Um, so these are some of the colors that can be seen here on this photo that can show like what the normal discharge may look like and what unhealthy discharge it may look like that a lot of people are not aware of.
Similarities between the two. Both can be treated by antiprozodal medications, which we mentioned previously. They have possible negative side effects on pregnancy. This can include stillbirths, miscarriages, as well as issues during pregnancy. It can cause changes to the vaginal environment like pH, and same populations are at risk.
So in conclusion, we see that both trich and BV are very common. They are often mistaken for infections that are mild or, maybe something that people may think can clear up on their own. So the important things about this are for a woman to know their body. Even if they don't know their body per se, a lot of routine screening can definitely help. Education is able to help as well. Knowing the risk, the signs, the symptoms, knowing that it is important to get screened regularly, and also knowing which population is at risk. As we mentioned, the women of younger ages are mostly affected. And here are a few of our references. So with this, we hope you all learned a lot about trich and BV, the signs and symptoms, and how to prevent it from being spread. Thank you.
Thank you.